I'm talking about electronic health records from the clinical side of things, from the hospital records. And it all started out with a challenge. A challenge to the statisticians to see whether we could do better than the clinical rules. So at a hospital encounter, there are many times when data are generated from the laboratory, the pharmacy, the OR, afterwards, complications. And they all look different. Some are type things, some are categorical, some are text, some are numerical, and they all come from different systems. From pharmacy, from registration, from nurses' flow sheets, from clinical notes, and we need some help from natural language processing to get this information out. And this has to come together. Now, right up front, we love challenges. We felt statisticians are in a very good position to be able to predict complications well, because we can do lots of data at the same time. But the question is, are these data really ready for prime time? There was already, the first problem was to define what's the index case, what's actually the primary surgery to start with. And the other is that all these systems have different standards, and it was difficult to get them together. However, we can use different time points, use cumulative information to at any time predict the risk of complications. So we did, and since we're statisticians, we had to compare different machine learning algorithms. And here is just the visualizations of two variables. If you see red, it's a high probability for a bleeding complication. The result was that we can be better at predicting bleeding complications than the clinical rules could. We were not so good at other types of complications, more equivalent. And the other result was, for all the machine learning people amongst you, all these machine learning algorithms were equally good, or equally bad. What? That was one part. And dealing with all the missing data, our large data set whittled down really fast. The other problem that I've been working on is clinical pathways. So some are standardized, and then there are various places something has to happen according to this pathway. And I wrote like a 30-page statistics report to do comparisons, and some very smart IT people converted this 30-page into a one-page colorful picture that each provider could actually see how well they do on compliance from the different elements. And also compare some of the outcomes, like here in the middle, just like we say, for themselves and compared to the departmental average. So that was very handy. And then we can take this even further to mobile apps, where the physician has this iPhone with access to the individual patient's information of the pathways where the complications occurred. You could actually quickly see, because of something that wasn't followed in the pathway, makes it much more likely to develop complications. And it had a huge impact because it's possible to identify potential problems quickly. And the clinician effort is down from 30 minutes navigation medical records to 4 minutes. So that makes a huge, I'd rather be in that position. So we have actually discussions about, is it possible, can we leverage electronic health records as they are available right now? And we thought, we're hopeful because of the experience that we did with, smaller data set. The question is, can it be upscaled? And there are lots of discussions going on. Stratus is an international initiative where 70 statisticians on 15 countries on the steering group. We have a number of different topics. Our objective is to develop guidance documents for applied researchers, not just statisticians, but also statisticians at different levels, to make state-of-the-art statistical methods available and to automate some of the things that we're talking about. We're also talking about the electronic health records, and this is in different countries. So other problems. And in particular, I'm working with data, trying to combine them from different countries, and there's the problem of different units, different languages, and different ways of recording. So it's actually not quite clear how well it can be used at this time. One other thing that we really like to achieve is to automate things, especially in the initial data analysis stage, to combine the different data sets, because they just don't speak to each other in these different systems. Thank you.